halos around lights, a painful red eye, blurry vision, nausea and vomiting, eye pain in addition to brow pain. What could I be describing? I could be describing symptoms and features consistent with angle closure glaucoma. Please do continue watching this video to learn more about this potentially devastating, sight-threatening, non-reversible condition. In order to understand the condition of angle closure glaucoma, it is first important to understand what the angle actually is. So inside our eyes, we have this fluid called aqueous humor. Aqueous humor, amongst its various functions, is responsible for providing nutrients to different aspects and components within the eye, including the lens. Once the aqueous humor has been formed, it needs to drain out of the eye. So essentially, aqueous humor comes in, it then fulfills its various functions and then passes out of the eye. Now, the region through which it passes out of the eye is referred to as the iridocorneal angle, which you can see from the picture on screen now. In angle closure glaucoma, what basically happens is, for various different reasons, this angle closes down, and as it does so, it makes the passage of fluid out of the eye initially reduced and then potentially completely impossible. And it's like a pipe essentially. If you have a blocked pipe, the pressure within that piping system will increase until the point at which you get a complete obstruction, and the pressure at that point skyrockets. There are various different subtypes of angle closure glaucoma, and the mechanisms via which they take place also differ slightly, but for the purposes of this video, I'm just going to be talking about the most common type of acute angle closure glaucoma, and I will try and keep the contents of this video as simplistic as possible in order for everybody to understand and follow the content. So at the beginning of this video, I described several of the symptoms that patients may potentially experience with an angle closure glaucoma attack. What I also need to mention is, in Far East Asian patients, angle closure glaucoma tends to be more common, and in certain groups of these patients, they can actually be asymptomatic, which is quite difficult to get your head around when you think how symptomatic some patients can be with the painful red eye that they develop through this condition. In terms of clinical examination, the hallmark textbook features of angle closure glaucoma include a red looking eye, a vertically oval mid-dilated pupil with potentially minimal responses to light, central corneal edema, elevated intraocular pressure, and a reduction of vision, so blurriness of vision. Some patients, if asked, may have a positive family history for angle closure glaucoma, or the patient may very well have had an attack of the condition themselves in the past. When being evaluated for potentially an angle closure glaucoma attack, the angle within your eye will need to be carefully and accurately assessed by your eye care practitioner to try and understand whether the angle is indeed open or closed, and to what degree this may be the case. This not only will help with trying to make the diagnosis and plan treatment, but for instance, if the angle is wide open and the patient is very symptomatic, then the eye care practitioner will need to consider other potential causes of why the pressure may be so elevated in the presence of an open angle. It is important, as with any other condition in eye care and in medicine, for the eye care practitioner to perform and carry out a careful and accurate history from the patient, because there may be several features in the patient's history that may provide clues as to potential precipitants for an angle closure glaucoma attack. This may include the use of bronchodilators, so patients that use inhalers to manage their asthma or their COPD, for example. It can also be associated with topiramate, which is another quite commonly used drug. It can also be associated with anticholinergics. The important thing about angle closure glaucoma from the patient's perspective and from the practitioner's perspective is to recognize it as early as possible, refer to the appropriate medical practitioner as soon as possible, and the condition needs to be managed as quickly as possible to try and lower the elevated pressure within the eye and to try and prevent any long-term damage from occurring to the optic nerve head, which can occur if the pressure is elevated for a sustained period of time without treatment. In terms of treatment, this will involve a combination of several different types of eye drops, and it will also involve either a tablet or an injection form of essentially a water tablet to try and help lower the pressure. At the end of the acute management, and once the pressure has been successfully lowered, patients will also need to undergo a procedure known as a PI. And what a PI will involve is creating a hole in the colored part of the eye, which is the iris, and this will allow an alternative drainage angle to be present, so that should there be another angle closure attack, there will be this patent drainage channel through which fluid can continue to drain, and therefore the pressure will not be elevated. Thank you so much for watching this video about angle closure glaucoma. In my other video on this channel, I spoke about open angle glaucoma through the story of a real life patient that I met in Kenya. This video also talks about angle closure glaucoma, which not everybody is aware about. Everybody tends to think that there's only one type of glaucoma. However, there are several different types of glaucoma, and today I discussed the angle closure type of glaucoma. If you have found this video useful, as ever, please do give me a like and kindly subscribe to my channel. Thank you so much for watching. God bless. Take care.